Chronic stress has been associated with impairments of neuroplasticity, such as neuronal atrophy and synaptic loss in the medial prefrontal cortex and hippocampus. Stay tuned because today you will discover the impact of anxiety and pain on the function of the brain. Hi there, I'm Dr. Krista Burns, founder of the American Posture Institute and your host on the Virtual Neurology Summit. The purpose of the Virtual Neurology Summit is to provide healthcare professionals just like you with brain-based solutions to reduce stress and improve neurologic function for your patients. I'm honored to welcome our next guest expert. Dr. Randy Beck, Executive Director at the Institute of Functional Neuroscience, is an internationally renowned expert in the field of clinical neuroplasticity and neuroplastic restructuring techniques. His textbook on the subject are considered the standard in education and clinical practice in the field of functional neurology. Dr. Beck was a professor in clinical neurology at the Carrick Institute of Graduate Studies and a senior lecturer in neurology and clinical diagnosis at Murdoch University in Perth, Australia. Dr. Beck is the past president of the Australasian Academy of Functional Neurology. Today, he'll be sharing with us, do anxiety and pain change the brain? Dr. Beck, thank you so much for joining us again this year on the Virtual Neurology Summit. Please take it away.
Oh, no, thank you very much. I really enjoy the quality of this summit, and I am very, very happy to be involved and excited that we can share actually a very exciting topic this year.
Hi, and welcome to the American Posture Institute's Virtual Neurology Summit. I'm Dr. Randy Beck, and I will be going over a presentation on how stress affects the brain. I think it's a very important and topic that needs to be addressed. I'm going to be in the top right-hand corner of your screen. And so let's get going. Okay, so first thing is we need to address what is stress. So stress basically is a word that describes how your body reacts when you feel under pressure or threatened. And the interesting thing is it's a very hard thing to describe. And the adage, the old adage that how do you tell the difference between pornography and art? Well, it's pretty hard to tell, but you know it when you see it. Well, it's the same thing with stress. It's hard to describe sometimes what is stress because different people have different stress levels and different stressors. But when you're under stress, you know it. So basically, the really interesting thing is that stress causes our body to respond in a certain way. And we're going to go through some of those things. And when it's responding correctly, it helps us. So there must have been some kind of adaptive advantage for the people who had this stress in their genes, had the response to stress in their genes that other people didn't, and that we had an evolutionary advantage, and we got to where we are today. However, things are different now in our society. So our society has changed from when we were fighting lions and struggling for food and things like that. So our body hasn't caught up yet, it seems. So one of the things is that stress and the way your body responds to it really doesn't differentiate between what is a real life-threatening situation and what is something that you imagine to be a life-threatening situation. So things like unpaid bills and work deadlines and relationship problems, they can all result in stress. So let's look a little bit at what things happen when we're under stress. Well, lots of times associated with stress, we get chronic pain, or chronic pain may cause stress. Insomnia, other sleep problems, altered sex drive, problems, eating too much or not enough, difficulty concentrating or making decisions, fatigue, depression, general unhappiness, anxiety and agitation, moodiness, irritability, anger, feeling overwhelmed, loneliness and isolation, poor judgment. So you see there's a whole range of things that are affected by stress. And you'll notice that it's not just the brain that's affected or the nervous system that's affected, it's other areas of the body too. Now, in this presentation, we're going to focus on two areas, pain and anxiety. But we cover this in much more detail in our diploma program, which you can get information on at the end of the presentation. So we're going to focus on anxiety first. So what is anxiety? So the sort of scientific way we can look at it, or the psychological definition, anxiety can be thought of as a future-oriented emotional state that is characterized by anticipative, cognitive, or behavioral or affective change. And it's in response to uncertainty or a potential threat. Now, as we've said before, uncertainty and potential threats can differ between individuals about how much that is going to affect their psyche. Now, basically, although anxiety can have a positive role, extreme anxiety or anxiety disproportionate to the actual presence or the likelihood of a threat, and it happening in a chronic situation can cause clinical anxiety disorders in people, which causes a variety of problems for them in society. So let's look at how does this stress that happens inside our brain, this feeling or these things that we sense, how does it translate into affecting our body and the networks in our brain? So basically, immune signaling can contribute to the regulation of the hypothalamic pituitary adrenal axis. Now, we've heard about the hypothalamic pituitary adrenal axis. You probably heard it in other presentations, even in this particular summit. But I'm just using it here in a little bit different way. I'm not going to go into the actual axis itself so much, but how little different approach to this axis can also contribute to the way our brain perceives stress and how stress acts on our brain. And what we're going to talk about is how when we have this perception of danger or some kind of uncontrolled activity that's happening against us, we will release corticotropoid releasing hormone, which will act on the pituitary gland, and then pituitary gland will release ACTH, which will then act on the cortex of the adrenal gland and release cortisol and other glucocorticoids. We're going to focus mainly on cortisol because that is what has been mostly studied in recent times. So the cortisol now affects a variety of areas of the body. I'm going to talk about that in a second. But one of the other things it does is it goes back to the hypothalamus and it monitors or changes the level of cortisol that's released. And in that releasing of cortisol, it also has effects on the immune system and components of the immune system, which then will also circle back into the brain. So let's talk about cortisol a little bit. So basically what cortisol does is it raises the amount of glucose, first of all, in your bloodstream. It helps the brain use glucose more efficiently and effectively. It raises the accessibility of substances for tissue repair, because remember, another form of stress is physical stress, where you're actually damaged or you have been injured in some way. Now, it restricts or reduces functions that are non-essential for life. So things like dampening reproductive responses, altering immune system responses like I've talked about before, and affecting parts of the brain that control fear, motivation, and mood. So all this helps you deal more effectively with a truly stressful situation when it's real and it's acute or short term. But when it starts to become chronic and happening all the time, the system starts to fail. And we'll go into how that happens now. So basically, when we have stress, another thing that happens is our sympathetic nervous system upregulates. It starts to dominate. Okay, so when this overactivity of the sympathetic nervous system causes a decreased activity in the parasympathetic system, and also results in the release of pro-inflammatory cytokines. Now, remember, when you are injured, you want these cytokines to be released just on a very short-term basis. But if this is happening on a chronic basis, you're now going to get not only the release, continual release of these pro-inflammatory cytokines, but you're going to have exhaustion of the adrenal cortex. So it's not going to be able to produce cortisol at the rate in which it has to suppress the inflammation that it's signaling. So you get this vicious cycle where you have adrenal exhaustion, plus you have increase in pro-inflammatory cytokines within, which then cycle back into the brain. Usually the inflammatory cytokines are considered to be interleukins 1 and 6, tumor necrosis factor, things like that. Now, once they start circling back into the brain and affecting the way different networks work, we start to develop different non-productive activity in some of these networks, which we'll talk about in a minute. And this results in fear and worry and hypervigilance and a bunch of other things. And we'll go into those networks in a minute. But first, I just want to look into how these cytokines actually affect the brain and how they get into the brain. Because for a while, we had difficulties understanding how the cytokines could actually functionally modulate brain activity, because we didn't think they could pass the blood-brain barrier. And so now we know that for a variety of reasons, these cytokines can cross the blood-brain barrier because we have found pro-inflammatory cytokines such as tumor necrosis factor alpha, IFN gamma, interleukin 1, which is actually regulating synaptic transmission inside the brain. So we also know that there are resident immune cells that can recognize and react to cytokines. And these are the microglia that, interestingly enough, embryologically have migrated into the brain before the blood-brain barrier has formed. So they're in there before that barrier has formed, and they are carrying with them receptors for these cytokines that are somehow being transmitted across the blood-brain barrier. Now, when we have an anxiety response, there are some key areas in the brain that are identified or implicated in this maladaptive process that we're talking about. And these include mainly the amygdala. The amygdala is probably involved in 4 out of 5 networks that can result in different aspects of anxiety being formed. But the amygdala is a main area of involvement. The bed nucleus of the stria terminalis, ventromedial prefrontal cortex, orbital frontal cortex, dorsal medial and dorsolateral prefrontal cortex, and the anterior insula. So this little diagram here is just outlining those areas inside the brain, just to give you a spatial orientation to where they are. Now, here we're going to look at when we have maladaptive plasticity. So neuroplasticity, we usually think of neuroplasticity as a good thing, and usually it is, and we can use it to help people that have got maladaptation in their nervous system or dysfunctional networks, and help them replace those networks. However, it can also be maladaptive in nature. So when we have plasticity in the cortex, for one thing, there was also some concern or doubt whether this neuroplasticity could help or happen in different areas of the brain that are involved. So for instance, we know the cortex usually can have a great ability to have plastic reactions, but we didn't know whether, other areas of the brain that we thought were involved, for instance, the amygdala, the striatum, whether there was a comparable plasticity in those areas. And now we know that in fact, those areas are plastic also. Now, they all those areas will have at least 3 different types of plasticity. So neuronal replacement, dendritic remodeling, and synaptic turnover are all types of plasticity that can happen in those areas. So what I'm trying to show is that the connection between what our brain perceives, so some kind of threat, how that threat causes a reflexogenic reaction, both in the hypothalamus, pituitary, adrenal axis, and also in the sympathetic nervous system, which result in this state that we get in, known as anxiety. Okay, and this anxiety can be quite debilitating if it builds to a certain level. So basically, we're now seeing that effects of those things, the reflexogenic effects, can cause cytokines to actually go into the brain and modulate activity in networks, as well as the activity that causes psychological phenomena inside those network activities. So we get a reinforcement almost of a cytokine that is basically a pro-inflammatory cytokine. And this will be important when we talk about how to treat these things. Okay, so let's look now at the anxiety networks that I was talking about. Now, this is from a group in niche who have done some work back sort of in around 2012, 2013. So it's about 10 years old now, but they've dissected out the networks that can be involved in anxiety production, and even the different components of anxiety. Excuse me. So we have different networks that overall the anxiety is sort of controlled or manifested inside these different networks here, but different components of those networks can produce different types of anxiety. And so if we have a dysfunction in one of those, you can have a predominance of that symptom manifesting in the anxiety syndrome that you're experiencing, or you could have all 5. So these are talking about increased attention and hypervigilance. So if you think something bad is going to happen to you and your amygdala activates, you're going to be hypervigilant of your environment, okay? And you're going to have hyperattention. And sometimes this can be confused with ADHD, when we have the difference being hyperattention and attention deficit are both a diagnosis of behavior. So sometimes when you are hyperattentive, you look like you have attention deficit disorder because you're not responding in the way that people expect you to respond to direction. However, you'll notice, like I said before, that the amygdala is 1, 2, 3, 4, 5, 4 out of 5 possibilities of anxiety involves the amygdala. So that's it's a huge sort of primitive emotional area of the brain, which really does tell us when to be afraid. Okay, so that's activating in these cases. Now I'm going to shift from the anxiety component to the pain component, because the pain actually can produce anxiety, and in fact can produce stress. And when we're under stress, we can feel pain more. So there is some kind of a relationship between the two. And I just wanted to sort of take you through a little bit of that. Obviously, we can't cover it all in this session. Now, basically, pain is always subjective. So you can never feel someone else's pain. You can only empathize with them about your understanding of the pain they're describing. Acute pain basically probably arises most of the time from nociceptive activation. And that means that there's a pain generator that's generating a type of signal that is damaging something. And then we, through different pathways in the spinal cord and through the thalamus, we feel that pain and we can locate that pain. Now, chronic pain usually is defined as lasting more than 3 months. And it has usually some element of some type of central sensitization, whether it's in the spinal cord or in the somatosensory cortex somewhere. And it's a complex sensory and emotional experience. It varies widely between people. So these are, this is where the cognitive and emotional factors come in, which cause it to behave or look like it may be able to create anxiety, or that stress may be able to make pain worse. And you can see when we look at the areas of the brain that are involved, there's that amygdala, prefrontal cortex, cingulate cortex, somatosensory cortex, all these areas that are involved in the other areas of the brain that we talked about. So you can see how these overlapping networks can produce similar sensations and crossover sensations in different people. Now, the childhood stress, so abuse, child abuse, or stressful situations in childhood can actually cause epigenetic changes that, for instance, demethylate different genes and cause them to either activate or activate in a way that is inappropriate. And so in these situations, we see that childhood psychological stresses tend to develop into syndromes or situations that don't usually respond to the typical type of treatment that we're giving people. So we need to be very cognizant when we're investigating chronic pain, chronic abuse situations, to make sure that we also consider changes in network dynamics that are happening in these kids. So how do we treat these people? Well, basically, it's a common sense approach. We want to eliminate inflammatory issues. We want to eliminate things that cause inflammation. So we want a healthy diet. We want to reduce processed high fatty foods. We want to reduce sugary foods. We want to aim for 7 to 8 hours sleep a night if we can. Exercise on a regular basis, minimize the use of caffeine and alcohol. Try to stay socially connected, because the interaction of those networks necessarily involves being around people. And make time for rest and relaxation. Learn relaxation techniques if you can, so deep breathing or meditation. Avoid medications that interfere with the gut biome. Avoid pesticides, herbicides, other toxins in the environment if possible. When you're investigating these people, look for some type of nutritional deficiency that might be there, and you want to restore the activity, the healthy activity, back to these networks. So you can use certain types of neurofeedback or neuroplastic restructuring of the type that we do at the Institute. So I'd like to draw this to an end now, and hope that you enjoyed the little presentation. I know you want to probably go into it in much more depth. And if that's the case, you can send me you can contact me, randyw@yahoo.ca, or if you're interested in learning more about how to apply this stuff in clinical practice, go to our website, ifn.net.iu, and look for our clinical affiliate program, and you'll have a whole bunch of information there. So thank you very much. Enjoy the conference and stay safe.
Excellent. Dr. Beck, thank you so much for your incredible presentation. I'm going to do a quick summary of some of those highlight points, and then we'll do a Q&A. So first of all, you started talking about what is stress, and it's how your body reacts when you feel under pressure or threatened. Stress causes our bodies to respond in certain ways. The nervous system can't distinguish between emotional and physical threats. So the body responds just as strongly to things such as deadlines or financial stresses as it does life-threatening situations. How stress affects us: so chronic pain, insomnia, altered sex drive, GI issues, fatigue, depression, anxiety, agitation, poor judgment, among other things. When we hone in and look at anxiety, anxiety is future-oriented emotional state or anticipating cognitive or affective changes and uncertainty or potential threats. Disproportionate and chronic anxiety can cause a variety of problems. We talked about the HPA axis. So this is immune signaling contributes to the regulation of the hypothalamic pituitary adrenal axis and other neurobiological processes that modulate affective behavior in the face of exposed stress. Release CRH to the pituitary gland, then ACTH to the adrenal glands, which then releases cortisol. And then cortisol goes back to the hypothalamus to monitor cortisol releasing, impacting the immune system. And cortisol raises glucose in the bloodstream, helps the brain use glucose, helps with tissue repair, but it also reduces non-life-threatening or non-life-sustaining function and affects the part of the brain associated with fear, motivation, and mood. So when our body's stressed out, we put all of our attention towards maintaining homeostasis, and thus our thrival networks are being decreased. And then chronic exposure to trauma and stressors. So overactivity of the sympathetic nervous system decreases parasympathetic nervous system output and increases release of pro-inflammatory cytokines. When injured, we need cytokines on a short-term basis. They serve us from a homeostatic perspective, but when it's chronic, it leads to exhaustion of the adrenals. So pro-inflammatory cytokines cycle back to the brain. They affect brain networks and develop non-productive activity and hypervigilance. Cytokines pass the blood-brain barrier, and resident immune cells recognize and respond to the cytokines. And then the brain regions for anxiety includes a network such as the amygdala, the prefrontal cortex, anterior insula. And the neuroplasticity can be maladaptive. So when we tend to think of neuroplasticity, we think of neuroplasticity as a wonderful thing, which it absolutely is. And also, because our brain is responding to the activation that it's receiving or not receiving, it can also be maladaptive. So structural neuroplasticity of the amygdala and prefrontal cortex can be associated with anxiety. There's neuronal replacement, dendritic remodeling, and synapse turnover. And acute and chronic stress can cause an imbalance of neural circuitry, subserving cognition, decision-making, and behavioral states. And then anxiety networks, so we have altered estimates of harm. So we're over-anticipating the amount of harm, increased attention and hypervigilance. And as you mentioned, hypervigilance can actually be distracted or confused for ADHD symptoms. And then that leads to deficient and safety learning, behavioral and cognitive avoidance, and heightened reactivity to that uncertainty. And then anxiety networks include the amygdala. 4 out of the 5 include the amygdala, activating that fear response or being afraid. And then what is pain? Pain is an unpleasant sensory and emotional experience, acute pain being nociceptive activation, whereas chronic pain is much more complex. It's lasting longer than 3 months, and we have some sort of central sensitization that's impacting the patient, and they're having not only a complex sensory, but also a complex emotional experience with their pain. Pain and suffering are not synonymous, and yet our chronic pain patients tend to think of them together because of the emotional experience they're having. And then cognitive and emotional emotional factors which can cause anxiety, and stress can trigger it. Childhood stress can cause epigenetic insults that will continue to impact the child throughout the rest of their life, can lead to syndromes, for example. And then when we talk about treatment, so how to treat these patients, it's about eliminating inflammation and making sure they're getting adequate sleep, exercising, minimize caffeine and alcohol, stay social, learn relaxation techniques such as breath work, meditation, avoid pesticides and environmental toxins, restore healthy activity to dysfunctional brain networks with activation. Dr. Beck, thank you so much. We learned so much from your presentation. A couple of questions for you. I want to highlight just right here at the end, it says restore healthy activity to dysfunctional brain networks with activation. Now, I know that you are the expert in this with neuroplasticity and you dive deep at the Institute. What are some examples that practitioners can do for either homework for patients to do at home in between visits or in office to really stimulate those neuronal pathways, especially if the patient's been suffering from either anxiety or chronic pain and they're having an emotional experience around it?
Right. So look, the exercises that activate deep, old emotional pathways in us, like the vestibular system or the cerebellum, are always good places to start. So you can activate the vestibular system by rolling on a gym ball, for instance, so lying on your stomach, rolling in different directions on the gym ball. You could do novel activities like walking backwards, spinning in various directions. You can use music therapy. You can use vibration. So all of the things that are stimulating sort of primitive areas of the brain. And we know that music is a very emotionally active component of the nervous system. So those are some things that you can start with. And you have to really be careful that you don't let the patient do too much, because you have to remember their system is not, doesn't have enough enzymes in it in most cases to have a lot of this new novel stuff happening. So you really have to make sure that when they, for instance, if they're doing a vestibular exercise or they're doing a cerebellar exercise, if they start to feel dizzy or nauseous, they stop. They don't try to push through. It's not like a workout in the gym. Mm-hmm. Okay, so those are things to watch out for.
Wonderful. And when it comes to, stress responses, so it's easy to say, well, we should just eliminate stress, or our patients should be less stressed out and they'd be healthier. I think we all understand that, especially within the last couple of years, stress has been through the roof and people are highly affected by it. How do you recommend changing our response so that we're not triggering or stimulating the amygdala to go into a fear response or fear avoidance if we're faced with stress? How can we train our bodies to be more resilient to that stress response?
Yeah, so I think the start is we have to understand what our triggers are. Mm-hmm. And that seems like a sort of fairly straightforward thing, because you would think, wow, this happened to me and I felt the stress. I actually had a patient this morning, and she has been bullied and I suppose by her family and by her siblings when she was a younger child. And now she's waking up at night and she's waking up in a cold sweat, reliving the dialogues that she had when she was a child. Okay, so it shows that these things happen probably throughout our whole lives. And why this is triggering her now is interesting, because she has just recovered from COVID. And now she has brain fog. And now she's starting to relive these, old triggers that were buried deep inside her from childhood. So it just goes to show that when you have some kind of additional stress, like the fog of COVID that's been left over, these things can emerge that you had once had under control. So identifying the triggers is sometimes more difficult than we think.
Right.
But once you identify them, obviously you want to try and avoid them. But more than that, you want to build resilience in your system so that even if you are triggered, you respond in a more moderate fashion.
Yeah. And respond quicker as well, so you don't stay in that loop, I'm assuming as well. Wonderful.
Absolutely. Absolutely. So this is a tremendously rich area of investigation, and being so, it's also a rich area of getting a benefit for people. Okay, so the benefits that we can get if we can figure out how to treat these people are going to be huge.
Mm-hmm. I love that. Yeah, it is very rich information. It's learning, it's taking a deep dive into the case presentations, understanding how they present their case history. But when we fully understand it, the rewards will be life-changing for these people.
Absolutely.
Dr. Beck, can you tell us a little bit more about the Institute of Functional Neuroscience and where we can learn more from you?
Right. Okay. So the Institute, the Institute is the clinical arm of what we do. So the Institute treats people and does research and that kind of stuff. And then we have teamed up with several other companies now that, like the Australian Institute of Clinical Neuroscience, which does education. So I do a series with them, which is a diploma in clinical neuroscience. And then we have a graduate diploma in clinical application for clinicians, so you can actually apply this stuff in practice. And then I've also teamed up with another company called Medicell, which is an IT company. So we now have the ability for you to upload patient data into the cloud. We then analyze that data, send you back a treatment plan, and you can actually treat the patients in your clinic. So it's starting to evolve, and I think COVID pushed us in this direction because we needed to have something online. And so now all that stuff is out there and operating, and basically patients all over the world are getting the benefit from this.
Absolutely. Well, thank you so much for providing those great resources for us. I want to encourage everybody to be sure and check it out. And as we wrap up another great session today on the Virtual Neurology Summit, I'd like to acknowledge Dr. Randy Beck for his excellent work as a pioneer in the field of functional neurology. And to all of our viewers, I'd like to acknowledge you. Thank you for your commitment to brain-based correction and objective clinical results. I'm Dr. Krista, your host of the Virtual Neurology Summit. Be sure to check out the Postural Neurology program to get certified with brain-based postural correction. And remember, with postural neurology, you can stop guessing and start knowing. Stay tuned, and we'll see you on the next Neuro Masterclass, the Virtual Neurology Summit.